Hey, hi everyone. Thank you very much for attending, for turning up to the webinar. We've got three of us here. Shakura is doing the tech, just here. She's just off the shot. And Dinah and I are going to be doing some demo and some practical work. So let's first of all just say hi on the chat. Hi, Jane, Francesca, Karen, Adrian, Francesco, Rachel, Donna, Carol, Joanna, Carolyn, Laura, and so on. That's it. Say hi. Yeah, really looking forward to today because we're going to be doing 3 webinars. You can sign up for each one individually. So if you like this one, you can sign up for the next one. We're going to be going into diagnosing and treating the back with Shiatsu and TCM. There is already an online course that we made quite a few years ago now.
Yeah, and if you want more, definitely go there. That's a great course. It's all video based, so you can see us. In fact, I don't think I'm much involved, but all the team are involved in making videos looking at all the different meridian pairs and their relationship with different back pain. Yeah, so it's a great course.
So we're going to just take some bits out of there. So let's have a look at the slides and see what's happening, what's going on. Do you want to do it? It's disappeared at the top there. There we go. There we are. Hooray! Actually, we all need to go back a bit because we need to start at the beginning. There we are. Okay, treating the back with Shiatsu and TCM. It's 3 webinar-based workshops, and I'll do it. So it's free. Just sit here. That's it. Okay, so yeah, over the 3 webinars, we're going to break it down. So this week, we're going to look at Western medicine, contraindications, and we're going to focus in on the lower burner, diagnosis and treatment. Next week, we're going to look more detail in TCM, look at the middle burner, how it can affect the diaphragm and the lower thoracic, and we're going to look at the idea of integrity, which is all from treating the back course. And then week 3, we're going to work on the upper burner. Hopefully, I'm going to be the model for that because I have upper back, tend to have issues with my upper back. And then we'll go a bit more deeply into multi-dimensional diagnosis. That's getting information from vibrational levels, from the past and things like that. So that's the program. Okay, so let's find out how confident you are treating the back, the lower back, in fact, with Shiatsu, right? I'm going to share the poll and just find out how confident are you in treating the lower back with Shiatsu. We'll get an idea. Oh, here we go. We did actually have a webinar, an advanced webinar on treating the back for members of the professional members last week, and generally they're more confident, but I guess that's probably to be expected because they're probably more advanced. But look, we've got over a quarter of you neutral or unconfident, so hopefully we'll be able to increase that. And those of you who are very confident, hopefully we can give you some more ideas for developing your work. Okay, very good. So this week we're going to look at Western medicine. We're going to spend about 15 minutes looking at how Western medicine analyzes and categorizes and treats back pain. Then we're going to have an overview of the advanced diagnostic method, and I'm very excited because I've come up with a new chart. I do like a new chart. So this is the very first time ever that my latest chart will be presented. I hope you like it. And then Dinah and I are going to do some practical work, diagnosing and treating Dinah, who actually happens to
lower back pain
today.
Lucky me.
Yeah, lucky you. So let's see if we can help Dinah and figure out what's going on. And we're going to go. I've got a lovely handout for you, and we can go into the meridians and points for the lower back. So hopefully that'll be useful for you. Okay, so let's just have a little look at what Western medicine says about back pain. So what is your level of understanding of treating back pain and understanding it in Western medicine? Do you think? Let's have a look. I'll run the poll now and just give us an idea. Here we go. Got a few experts in the audience, probably nurses or doctors even maybe. Oh, yeah, fairly confident generally on the whole, probably about just less than half good or expert. And we've got probably about half who think neutral, poor, and one person who's honest and says very poor, they know nothing. So let's have a look and see what we've got.
Let's check back to the chat.
Okay, yeah. Keep an eye on the chat. Yeah. Okay, so here we go. If you spot any, just let us know. Yeah. Okay, here we go. So we're going to do the introduction, classification, back pain, warning signs, because I think this is probably the one thing that we're all a little bit concerned about. There is a serious condition, very rare, but sometimes there are serious medical conditions that are contraindicated for shiatsu. So just watching out for those. The types of pain in Western medicine, common medical conditions, and passive and active management. So let's go through these slides. Okay, I think this is absolutely incredible. Like 90% of adults experience back pain at some point.
Unfortunately, there's a bit of a design fault in the upright human being.
Yeah.
So it's really, really common that even if it's, I mean, obviously for some people, it's a long-term, chronic, or it could be an acute, but at some point, somewhere in most lives, there's some back pain.
Yeah, I mean, I've had back pain in the past. I think we all have, haven't we?
Yeah.
So 90%, 50% of working adults have back pain every year. That's a huge number when you think about it. Absolutely huge. Half. And 40% of lost working days in the USA are caused by back pain. A lot of them are depression and things like that, but 40% is pretty sizable. Yeah. And it's the single leading cause of disability worldwide. So there's a massive, number of people who need help out there. Okay, just in case you don't know, there are 4 different classification areas in Western medicine: cervical, thoracic, lumbar, and sacral spine. And there's also specific and non-specific back pain. And what's all that about? Okay, well, there's specific and non-specific. So this is what, obviously, most of the time we're treating people with non-specific back pain. And I think this is really interesting as well, because basically the short answer is most of the time Western medicine doesn't really have much of an idea why that pain occurs.
Of course, they've got a fantastic understanding of the mechanics of the spine and the nervous system and the soft tissue supporting it and so on, and how it all should be.
Yeah.
But when people have got pain, they can take pictures and they can say, oh, yes, you've got this or you've got that.
Yeah.
Or sometimes they can say, looks pretty good.
Yeah.
We don't know at all why you've got pain.
No.
So, very...
I mean, one of the interesting things when I was doing this research is that actually spinal alignment and pain are not that closely correlated anyway. So you can have a wonky spine and be totally pain-free. You can have a very, very well
beautifully
aligned
and healthy looking spine and have endless pain.
Yeah. And I think Shiatsu's got a massive contribution there. It's so sophisticated in diagnosing it. Okay, so you've got specific, and that's the 2% that we have to be aware of, because that's where there is a serious pathology like cancer, osteomyelitis, epidural abscesses, abscesses, the epidural canal, things like that. And obviously we need to refer that to a medical practitioner. And basically what we're looking out for is things like bowel and bladder incontinence, fever, obviously, if there's an infection, unexplained weight loss, which is often an indication of cancer. Of course, post-trauma as well, like actual fractures that need to be treated rather than give shiatsu. That's usually pretty obvious if they've had a car accident.
It usually is.
Yeah. Osteoporosis, that's another one that's got to watch out for, though I have actually treated quite a few people with osteoporosis.
Me too. And there's just very obvious contraindications in terms of using a lot of strong technique on a frail person, but because you're bringing ki and blood and support to the whole system around the bones, even if they are frail, then you're bound to benefit the condition.
I've had some fantastic results with shiatsu.
Me too.
So multiple myelomas and a history of cancer, those sort of things to watch out for. Okay. So there's basically there's several different classifications, aren't there? But the most basic is the acute and chronic.
Yeah, and of course that's a slightly arbitrary categorization, but it's used for convenience, really.
Yeah.
So acute, we have acute pain to tell us something.
Yeah.
Get your hand off that hot plate.
Take the rock off your foot.
Take that rock off your foot, exactly. It warns of tissue damage. And chronic pain, it varies depending on the medical profession or the outlook, but
Yeah.
the sort of broad category is any pain that persists on most days
Right.
for 3 months or more, so
Right.
something like that.
Okay.
There'll be a variety. But there are 3 different sources. That's what that next list is.
Oh yes, yeah, that's right. Because you did a whole pain workshop, I remember.
Yes,
I
can talk to you about pain for hours.
Oh, you can. Yeah.
But I won't.
No, okay. So what are those 3? What are those 3 categories?
Well,
then?
really, these are the root, if you like. So
Yeah.
where does the pain come from?
Okay.
Nociceptive pain just basically means pain caused by some kind of harm. So if I punch you in the face,
yes,
I'm going to damage the tissue, and you will feel pain.
Right.
So that is the harm.
Yeah.
Neurogenic pain, and that manifests in lots of different ways depending on the type of harm, if you like, the type of trauma.
Right. Okay. Yes.
You know,
Whether
a
it's
crushing
cuts.
injury or
Right.
a cut injury or
I see,
whatever,
Yeah.
a burn injury.
Yeah.
Neurogenic pain is what it sounds like. Its
Nerve.
genesis is in the nerve.
Nerves.
Yes.
Right. Okay.
And that can manifest in all sorts of really surprising and disturbing ways. So sensations of water running down a limb, or of
Right.
fire burning in a limb, or of ants crawling in a limb.
Oh yeah.
You know,
Yeah.
it manifests in lots of different ways. And because the nervous system obviously has a huge network around the
Yes.
whole body,
Yes.
and it's all connected.
Of course. Yeah.
So you may have some damage in one part of your body,
Yes.
but you may find you're getting
Referred pain.
referred neurogenic pain in a completely other. And we all have, I'm sure most of you in your practice have had treated people with sciatica. This is a perfectly good example. So we've got damage or some challenge to the lumbar spine,
Yeah.
the root of the sciatic nerve, and the person has no back pain, no hip pain.
Yeah.
They've just got a weird feeling of pain in some part of their lower leg,
Right.
for example. That would be
I see.
And
Yeah, because
actually
it's so
the-
referred. Yeah. Yeah.
the genesis is in fact damage to the sciatic nerve.
Someone says, it's Karen, says, is Shakura in the chat? She is.
Yes.
She is. But
In
she's
a leaning round way.
But she's using we're all logged on as me. We're all 3 of us in the room, which is an amazing feeling. It's really nice. It's the first time we've done it. And so Shakura is here. You can say hi, friend.
Hello. Hi, guys.
Yeah. So, yeah. Okay, great. So
And psychogenic pain is, again, what it sounds like. Comes from the psychological root, so emotional psychological, I think we would call it, from the Shiatsu perspective. So, and often that's the kind of secondary pain. If you see what I mean.
Yes.
Because it's like
we've got that coming up.
Yeah,
Primary and
sorry,
secondary suffering. I'm sure that's the next thing. That's it. Yeah. We've got
medical
conditions. Strain, sprain or spasm, muscular, synovial spinal joint problems, herniated discs, degenerative disc disease, degenerative joint disease like osteoarthritis, and spinal stenosis. So there are various different medical conditions worth being aware of, aren't there?
Yeah.
I think I've treated all of those in various different combinations.
Yes, and interestingly, I mean, speaking as a person with quite a damaged lower back, for this long life story stuff. But it turned out when I had a very severe prolapse disc, where it says herniated disc, a few years ago at that Vienna Shiatsu Congress.
Yes, I remember.
After that, I had an MRI scan, and it turned out that all of my lumbar discs, bar one, had been prolapsed in the past.
Wow.
So this was a really severe one, all that pain. But my osteopath saw the MRI scan and said that the lumbar vertebrae were like a badly built wall.
All right.
So they were misaligned, and that probably goes back to childhood falls from horses and so on.
Right.
But interestingly, that degenerative disc disease is something that we will treat a lot in our clinics.
Absolutely.
Because it's kind of wear and tear on those poor old discs that can come from just literally lots of hard physical work, carrying heavy weights, carrying children, etc., etc. So really common, and so that it won't be dramatic.
No,
but it'll be chronic and challenging.
Yeah. Like Kara's just said about the fact that we had a professional members class last week. We did indeed, yes, and it's in the Tuesday tutorial section of the website. We kind of like Shakura and I did it, didn't we? And we basically got just the professional members, invited just the professional members, and we kind of trialed everything out to try and find out what the best combination is. And hopefully mainly what they asked for is more actual techniques and more diagnostic techniques. But we did have a lot of fun. If you're already a professional member, it's in the Tuesday tutorial section of the subscription site. And it's quite an advanced thing. Hopefully we'll get somewhere towards the end of these three webinars. We'll get somewhere close to what we did last week. Okay, so we've got, actually, where is that? I'm sure there's a primary and secondary slide, but anyway, maybe we'll come to it. Passive management is actually basically passive to the client is passive, I guess.
Yeah.
So they take medication, or they have therapy, they have manipulation, stimulation, or surgery. And active management, changing their behavior, exercising, and this is obviously psychogenic pain, changing the thoughts.
Strategies for managing.
Yeah.
So, for example, I have got quite a damaged back, but I've learned to manage it.
Yeah. Right.
So at the moment it's a bit sore, but on the whole, I'm pretty.
So that would be pacing as well, making sure you don't overdo things.
Yeah, and look at getting regular shiatsu treatments.
Yeah.
I sometimes have osteopathy or cranial
Qigong.
Yeah.
Qigong, yeah.
Practicing regular Qigong, stretching, learning how to, yes, there's a good example, learning how to look after your back.
Okay. James put a big post about the design. I want to put that as a question, James. So
great. I can't see it.
Yeah, mindfulness, meditation, and breathing, distraction strategies. That's for people with severe chronic pain, isn't it? To kind of take their mind off it, kind of thing. So let's have a look. Where are we? Well, yeah, that's it. Okay, so maybe we should just mention primary and secondary suffering, because that's a part of it, isn't it? Primary is the initial pain, the initial accident or the initial incident.
Yeah, and I mean that sort of relates back to the Buddhist concept of the path towards the resolution of suffering, if you like.
Yeah.
But in terms of treatment of our pain, I, for example, in Vienna, had that terrible, acute, agonizing, worst pain of my life.
Yes.
That's primary suffering.
Yeah.
But then for someone who, may have an initial episode, they've had a car accident or whatever, they're in a lot of pain.
Yeah.
But there's also, they may be then stuck with a chronic pain.
Yes.
And they've got to learn how to manage that chronic pain.
Yeah. And some of it can be emotional, can't it? Because it can affect your life, and you might not be able to do the things that you really love doing. So say if you loved going to the gym or something, you can't go for 6 months or something. Then you get frustrated because you can't go, and then you get pain because of the frustration and so on.
Yes, and actually, for something, I don't know, say you've got a chronic degenerative disease, there's the secondary suffering is not so much the pain in your hip or whatever it is, it's how you're finding ways to live your life.
Yeah.
And exactly, it's more of an emotional, psychological, spiritual relationship with yourself and your life.
Yes. Yeah.
That can, and that's where Shiatsu is so great, because we can address all of those different levels. Yes, we can help the bones and the soft tissue and blah, blah. Yeah. But we can also help people find a way of helping, of relating to their situation.
Absolutely. And when I was looking at those slides, I was just thinking to myself, what is Shiatsu? Is it active or passive? And it's kind of both, isn't it? That's the thing, I think. That's
the joy of it. That's exactly what it is. It's like, I'm going to lie down and you're going to, but you can engage me more or less.
That's right, yeah.
And you can empower me more or less. You know, we all do with our clients, don't we?
Absolutely, yeah.
And we give them simple things to do that they can incorporate into their lives. Meditative practice, breathing practice,
Exactly.
gentle stretching, qigong practice. You know, we've
Making
got
it
to,
as active as possible.
exactly, so
Yeah.
that they engage with their process.
Okay, here we go. So now we're on to the next stage. There's lots and lots of interesting stuff on the chat there. We're keeping an eye on it. We'll come back to the questions in a minute. Yeah, so the lower burner, we're going to look at the kidney, bladder, small intestine, and large intestine meridians. I've got a handout for you, which is actually from the back course, from the online back course. But I just thought we could run a poll and say, which of these 4 meridians are you most familiar with when treating the lower back? So what have you come up across the most? That'd be interesting to see. Let's have a look. Anyone want to vote? All the polls gone slow. Oh, here we go. Bladder. I think they were thinking about it. Probably unsurprisingly, the water element has come out.
Bladder and kidney.
Bladder and kidney, neck and neck. Yeah, exactly. There we are. Look,
Yeah.
80%, 86%, and kidney and bladder pretty much even. Yeah. Interestingly enough, though, the small intestine meridian and the large intestine meridian can be involved in lower back pain, and they quite often are. So it's worth watching out for them. And the interesting thing I'm going to be doing in the practical is we're going to start looking at how you can tell by using 2 different types of diagnosis. So it's a share handout. You see, I like to remind myself to do stuff.
Yes, boss.
Yeah, that's me telling myself what to do there. Okay, so I'm going to share the handout. You can download this and we'll put it online as well for you as well. But I've also got the relevant part of the handout. I've got actually right here, which is I've extracted from the handout and Diana's actually edited and put some extra stuff in it actually, about the basic meridian pair function it has, and the dominant local dominance, the U point, and then other points like distal points and other important points that are related to that meridian, and then some notes there. So we're going to just come back to that in a minute, because we're going to do some practical and we'll come back and just revise it. But I'd just like to show you typically how we would assess and treat all of those meridians for treating the back, I think. Shall we do that?
Super.
Let's just see what the next slide is. Oh, yes. Okay, this is my new chart. I'm so proud of my new chart. Okay, yeah, because I was trying to figure out, you know, we've done quite a lot of really advanced work with Gabriella with quantum shiatsu, and then we've done some even more advanced stuff on the astral plane and stuff like that. Yep. And I was really thinking about the last few weeks when I've been preparing for this work, these webinars. I was just really thinking, is there a simple way to just describe how we get information from the energy field and where it all comes from? And I think this chart is quite simple, because what it does is it shows 3 main things that we do. And I'm going to demonstrate 2 of those this week, and then we'll go next week, and the week after we'll go a bit more into the multi-dimensional information. So basically, the most basic way of getting information about back pain is literally by local palpation of the body tissue. And that often relates directly to the U point.
Yeah.
So the U point will affect the back. So we've got the kidney, bladder, small intestine and large intestine U points are all, if you look at here, we've got bladder 23, that's L2, bladder 28, S2, bladder 27, S1, and bladder 25, L4. And I'll show you how we palpate those when we're kind of checking out what's going on. So we've got that, but sometimes it doesn't quite work as simply as that.
Often not.
Often it doesn't, no. This is the kind of thing you might learn in Shiatsu school in the first year or second year or something. But probably a more reliable way to diagnose lower back pain is to use meridian resonance, which is basically by finding which meridian resonates with the particular meridians in the diagnosis. And Shakura and I did quite a lot of that last week, didn't we? Yeah. So that's what we'll be doing. And I think if I go, yeah, here we are. I told myself what to do again. I like that. Yeah, so now it's time for the practical demo. So you would like to be the model, Dinah. I don't get to lie down. That's so disappointing. Never mind. Okay, cool. So what I thought we'd do first of all is I'd like to just show what I would do just in terms of palpating the U points. Okay, should we do that? And then if you've actually got some real lower back pain, then we
You're
can.
suggesting it's not real.
It could be psychogenic. That's not real, is it? No, I'm joking. Yeah, and then we can use the resonance technique to maybe get an idea of what's going on, what's happening. Yeah. So I figured if you lay down like this here with your head here, and your feet there,
On my back.
on your back, yeah, and maybe come down a little bit this way. That's it.
Is that good?
And then what I'm going to do is I'm going to palpate like I normally would, and then I'm just going to tip you over like that, and then we'll get Shakura to do a close-up, because we've got another innovation this evening. Not only have I got a new chart, but we've also got a second camera, because we always have a little bit of trouble with close-ups and things like that when we're demonstrating things. So we thought we'd experiment with 2 cameras to make it a little bit more easy for you to follow what's going on. Okay, so obviously when you've got a client and you're doing a treatment, you'd obviously ask them, like, where is it? That's obviously the most basic thing, isn't it? Like, ask where the pain is. So I could ask you that now. Whereabouts exactly is it? That's a clean question, isn't it? Where exactly is it?
Where exactly it is across the sacrum, really.
Right, okay.
Lower lumbar and sacrum.
Okay,
So as I lie flat here, it's uncomfortable.
okay. Do you want a knee roll?
No, it'll be
Sure.
fine. It will settle, but I can feel it pulling.
I have got a knee roll if you want.
Yeah.
You're okay, yeah.
I can feel it pulling there.
Okay.
And this afternoon and yesterday, I'm showing him now.
Yeah.
Basically across there.
Do you want to roll over
I'll
this
show
way?
you.
Roll it?
Yeah, it's basically
Right, that's the whole sacrum and
Yeah.
around the outside of the
It's,
sacrum, isn't it?
exactly.
The whole area.
So sacroiliac, but it feels kind of generalized. And
Right,
it actually feels sort of tender
okay,
to touch.
okay. So now what we could do is we could do a horror diagnosis and we could check the resonances, okay? But before we do that, let's just check out the U points and see which is the kind of thing we can do. And that is, I like to do it in the supine position because the back is relaxed like this. So I can come round, I can feel feel the waist, feel between L2 and L3, and go out and feel the kidney U point. That's it, isn't it?
Mm-hmm.
Yeah. Okay, and so that I can get an idea locally from the back. So if I tip down over, I'll show you what I'm doing. I've got my hands underneath here, and I'm feeling the kidney U point like that. Yeah. And then if we go down, we can go down into large intestine, which is bladder 25. That's opposite L4. Let's just see if I've got that.
Bit lower.
There?
Yeah.
Okay. So again, I'll tip you over around like this. So my hands are like there. Yeah. And then we can go on to the sacrum. So this is maybe a little bit more interesting because this is where the actual pain is. So then if we go down onto the sacrum, what I like to do is I put my 4 fingers like this over the 4 sacral foramina, both sides, and then you can kind of get a readout. So this will be 1, 2, 3, and 4, wouldn't it?
Yeah.
Okay. So again, if I tip you over, I wonder if you could do. Do you want to do? Should we try doing a close-up, Shakura? This is the first time we've ever done it, so bear with us. I'm going to do a close-up. There we go. Hey. Yeah, you see, my hands are just there. You can just get rid of that settings screen, and you can see what I'm doing. That's it. Okay. So I've got my fingers right there, right on the sacral foramina, and this one, that's small intestine, isn't it?
Yes.
And then that's bladder.
Yeah.
Okay. So if you come back down again, that's it. That's it. That's it. Good. Small intestine, bladder. Okay. So each of those U points has actually got a different feeling to it, which you can obviously use diagnostically, just like we would do for all of the U points. Okay. So now, the second approach, which I also put in my chart, so I had local palpation, and then I had meridian resonance palpation. And what that is basically, It's probably the most common technique that I particularly use. I don't know about you, Chikura, did you use that a lot? Yeah. And Dinah? Yeah. Which is basically you can get information, resonant information. So what I would do there, or what we do, I should say, is place my hand underneath here. So do you want to come up on top of this? See, that's it. So I've got one hand underneath, that's it, like that. That's it. And then I'll go through the HARA diagnosis. And what I'm looking for is resonance between the lower back and the meridians. And what I'm going to do is I'm going to limit myself this week to the 4 meridians that we're looking at, and just to see which ones are doing what. Okay. Now there's 2 things that we look out for. There's a resonant connection, but there's also an energetic action, and sometimes they both happen really quickly together, so it's sometimes difficult to separate them out. But I'm going to try and separate them out for you, and if you kind of tune in through me, you may be able to feel or sense what's happening. So the first stage is to see what the resonant connection is between the meridian diagnostic area and Dinah's lower back. Okay, and what it feels like is it feels very similar to two-handed connection. That's the best way I can describe it. It just means that you get a feeling that there's some kind of connection between those 2 things. So let's just try that. So what I'm going to do is I'm going to palpate bladder, okay, and feel the connection between the 2. Kidney, okay, I'm getting a different sensation between my hands, yeah. Small intestine, very different, yeah, very different. Small intestine and large intestine, and again different again, yeah. So I've got the connections there, I've established the connections. The next thing I would do is I would check to see, I mean, I can already say that the small intestine is more jitsu, and it's got more of a, well, I'm going to say high frequency vibrational connection, but it's a much higher vibrational frequency.
And it made me want to cry when you first touched it.
Did it?
It's not that painful.
No.
There's
definitely some kind of emotional thing going on there.
Yeah.
So check in next week, and we'll tell you about how to check the vibrational levels. But anyway, so I would say we've got small intestine, jitsu, and I would say kidney kyo.
Yeah.
Would you agree with that?
Yeah. That's what I was suspecting.
Okay, and I don't know if you can sense that just by looking at that's got much more. It's much tighter, and it's got a kind. If I had to turn it to a sound, it would like a sound.
Yeah.
And this is more like a ooh sound. It's much kind of, it's much more killer. Okay, so that's the resonance. So the next thing is to check to see what happens when we treat it. And this is very similar to the Kyojitsu reaction technique. If you're familiar with the Matanaga style, with the Kyojitsu reaction technique, what we do is we hold the Jitsu and we work the Kyo, and we see what kind of energy movement there is. Well, this is much more like a sort of monadic method, a bit like Pauline Sasaki method, where you're just you're just experiencing vibrationally what's going to happen. So I've got my hand on this back pain here, okay? And I'm going to just test. So now what I'm doing is I'm not so much testing between the hands, I'm tuning in here in the Dinah's back to see what's going to happen. It's like a little microcosm of what's going to happen in the session. Okay, so let's just see. So my hand, my attention is here in this hand, and let's just see. Okay, there's a kind of almost like a dense feeling to it, and it kind of almost contracts in a way. Did you feel that?
Yeah. Yeah, I got a sort of reaction.
Yeah. Okay, and then kidney, completely different. It's more of an expansive kind of releasing type of feeling.
Yeah.
Okay, and this is a kind of, it'll come out fairly classic Kyojitsu here. You know, we've got Kyo here. With the danger of making things too complicated, what we could do is a Kyojitsu reaction here, and just test to see whether the small intestine and the kidney are connected, maybe, which they are. Okay. So basically, the information we've got now is that Dinah's lower back is a combination of the small intestine being Jitsu and the kidney being Kyo. Okay. So the next thing is to treat it. So what I'll do is I'll treat it. Maybe I'll treat those 2 meridians for you, and then maybe if you could treat the large intestine and oh no, there's only the large intestine left, isn't there? You could treat the large intestine with me if you wanted to.
Sure.
Yeah. Okay. And then because we want to leave plenty of time for question and answer, how have we Oh, we're doing 5 at a time, aren't we? Okay, so yeah, so basically what we can do now is hold the hand over the back pain. We know already that the small intestine meridian and the kidney meridian and bladder meridian are going to be involved. There's a suspicion that the small intestine meridian treated immediately is not going to release it very much because of the testing. You know, it felt more contracted.
Yeah.
Right, so what I would be tempted to do is go straight into kidney and bladder by lifting up the leg like this, going into this technique here. Get that? Yeah, that's it. So what I'm doing now is holding her lower back here, like that, and doing this classic Masnaga technique, working the kidney meridian on the back of her leg, like this. And I'm feeling any reaction in this hand here, this one right here in her back. Okay, so go down. And what I'm doing is I'm selecting out the subos that I can feel.
Oh, that was interesting.
What this
I
one is.
actually got a response in the chest.
Oh, did you?
So there's not the second one, the first one. Yeah, there.
Around
There's
there?
something right up here.
Right. So that could be like heart and small intestine, maybe, you know,
Kidney in the
heart,
chest, yeah.
kidney in the
sure.
chest or something. Because I'm switching to bladder because it's the pair of the meridian, paired meridian.
I'm getting it again.
Yeah.
I think it is the
I'm
5.
just going to tuck in a bit. There we are. That's better. Okay, so that's bladder. And then if you look on the handout, and we can switch back as well, the other thing that I probably do is work the kidney meridian down in the lower leg, like this, and kidney 3. It's a really great point there. So let's just see if we can get a connection between kidney 3 and the back, and that feels pretty good to me.
Feels great.
Yeah, really good. It feels, that's probably the strongest thing so far.
Yeah, it's strengthening.
Yeah. Okay, so now what I'd be tempted to do is to go back and maybe treat the small intestine. And for those of you who are not familiar with the Masnaga system, the small intestine meridian runs right here on the leg. We can put it into the stretch position, but I quite like doing it straight with the dragon mouse technique here. It runs just along here between the spleen and the heart protector meridian. I'm just using my knuckles here. And actually that doesn't feel too bad now. That feels really quite good.
And it's opening at the back.
Yeah. Fantastic. Okay, now we're going to just check the hara here. That small intestine jitsu is much more relaxed already, and that's quite a lot stronger already. So that's a good energy movement there. Okay, so let's do the other side. Let's just keep an eye on the time.
Move around.
No, it's right. I think Chico can work it out. Yeah,
she's got the camera.
Get the camera now. Okay, so yeah, lifting up, rotating, hand underneath. I've got my hand underneath. Is that possible to get that in shot? Just there, that's it. Yeah, that's great. See, I've got my hand underneath there. That's it. Brilliant. That's a very great shot. And then kidney meridian connecting with Diana's kidney meridian and connecting with the back pain. Now, the interesting thing is that what I really want to emphasize here is that her pain is not restricted to the kidney channel. That's the thing. It's right across the whole lower back.
And interestingly, at the moment, I'm getting this weird, almost feel sick.
Oh, really?
Yeah. Like, where's that from?
There must be some kind of connection with the
yeah.
emotion.
Exactly. I think there's emotional level stuff going on.
Yeah. So this is the Masnaga kidney channel, just up here. And then bladder. Yeah. Some great points here.
Yeah,
Really that's
nice.
A really good one.
Yeah, that's good.
So I'm actually selecting out the subos based on what I can feel in this hand here.
That feels really good. And that's easing this feeling here.
Oh goodness, thank goodness for that. Okay, then pop it back here. That's it. And then we've got small intestine.
Now again, this is affecting here.
Is it?
And it's got this kind of opening feeling.
Yeah. Let's just switch back to kidney. I'm going to just do this with my fingertip and going down the kidney channel. Let me just see if I can get. I'm going to try and go perpendicular with my fingertips here. There we go. It's a good connection, isn't it? Again,
Something ancestral happening now.
really. And then small intestine. And of course, you obviously build this into a whole session, into the whole session. But this is just give you some ideas, if you haven't already thought of them, of treating kidney, bladder, and small intestine on a real model, real person who really has them happening, which is amazing. Let's just check. Let's see if you can tune into the heart again and just see whether you can see the difference. Remember from when we did it before? So here's, look at that kidney channel, much stronger, okay, much less kind of soggy. Bladder's still a little bit kyo, and let's see, but look, that's a big difference, especially on this side. That's released really nicely.
It's a totally different note now.
Yeah, it's not so is
Yeah,
it?
it's more.
Yeah,
Really changed.
yeah. And the large intestine was very much in the background, wasn't it?
Yeah.
Okay, let's just check out and see if there are any questions. I think maybe we should have a little break and have a look at some questions.
Yes, lovely.
Let's
Thank you.
get back to the other camera. There we go. Yeah, brilliant. Okay, cool. There we are. Any feedback on the all right, okay, let's have a look. We've got loads of questions here. Yeah. All right, okay, let's just see. Okay. Let's mark some of these up as questions. Oh yeah, why didn't you check all the other zones? Yeah, that's it, yeah. Right, oh my goodness. Okay, I hope we've got more. There's 7 questions. Let's have a quick break and just go through the questions. Here we go. Hi from Indiana. Is there any way to have captions? I have hearing loss and have trouble understanding. Oh, the only way to do that is we can put them on YouTube. We put them on YouTube and then you get automatic captions, Deborah. That's the only way we can do that. Mainly because we have no idea what we're going to say. Karen said, was there a class for professional members last week? And there was. We did a trial for this this course. Okay, this is interesting here, Diana. Okay, here, I'll read it out for you. Actually, Diana, I disagree with the design fault theory. I think it's one of those answers like inevitable aging, which was originally thought up by people who had no other explanation. Alexander technique teacher, interactive teacher, often asked the question, are we badly made and have to do something to perform well, or are we well made and have to do something to perform badly? One of the causal problems in people thinking they should have a straight back when it's curved. Oh, that's interesting, isn't it?
Yeah. Yes, and of course, I was being.
You were being a bit flippant. You were being flippant, and look what you got. A great big question. It serves you right, Dinah.
That's true.
Honestly.
Yeah, but evolutionarily speaking, we have moved from being on all fours to being upright, and it has produced several challenges to our physical bodies.
It has.
Look at childbirth, for example. It's not an easy process.
No, it isn't.
And we do know that the areas of the spine, the back, that are most prone to challenges are the secondary curves of the cervical and lumbar spine, where we've got a lot more movement.
Yeah.
But I completely am with you, Jane, about the Alexander technique is all about learning how to use our bodies in more efficient and easy ways, and like animals do.
I tell you one of the things, because if you just read this, James also said the reason that she raised it is that if you've got someone who suffers from back pain, they might think they wouldn't be able to change it if it's a design fault.
Completely.
Yes, absolutely. Yeah. And actually, the the thing next week, I think it's next week, we're going to talk about tensegrity and look at tensegrity. And that's a really very positive model of how we can get really, really good functioning in our back. All right, and then we've got Catherine. Catherine was just very sorry to hear that your bad back. Yeah,
it was a useful learning experience.
I'm sure that, yeah. Right, okay. And then Gudrun says, and that's why also our own attitude towards pain, struggles, unexpected or unwanted experiences is so important.
Absolutely.
Yeah, that's it. Okay, here we are. Here's some more things. I'm interested to know more about why Dinah felt sick. I hope it's fleeting. I treated kidney on someone with back pain when I was a student and they felt acutely sick, so I had to stop. Oh, that's a shame.
Interesting, isn't it?
Yeah.
Yeah, well, how I interpreted it was basically key moving. And I would, because all pain has some element of stagnation.
Right, yes, that's which we'll do next week, by the way, on the TCM section. Won't we?
Exactly. Boutons et tons et boutons. Where there's stagnation, there's pain. And where there's free flow, there's no pain.
All right, okay.
So, so this is a dull pain, it's more of a chronic pain, it's more of a deficiency type of pain. However, there's an element of stagnation in there.
Right. Yeah.
And for me, is it Gudrun? I'm thinking that the fire element, the fire element's relevant.
Yes.
We had heart and small intestine in there.
Yeah.
And of course, there's a strong relationship between the emotional core and the liver as well. Do you know what I mean?
Yes,
so I'm thinking that basically as you worked working the kidney it was, but it's all connected, isn't it?
Yeah, exactly. And as Vicky said, why didn't I check all of the areas? I didn't check because it's the lower burner this week, and I didn't want to confuse things by going into it. Maybe at the end of the 3 webinars we'll do a full thing where we check all of them, because obviously this is the interesting thing. I have to emphasize this, and I'm going to put the slide up again. That I have to emphasize this, that the location of the pain is not the only thing that matters. You know what I mean? So, one tends to think lower back pain, kidney. Yes. But actually, you can have lower back pain related to any of the meridian, including the liver as well, as we'll find out next week, because liver is to do with stagnation anywhere in the body.
Exactly.
And the only real reliable way to find out directly whether that lower back pain is related to the heart, the liver, the whatever, is to check it energetically.
Exactly. And so I interpreted that temporary, and it was fleeting, by the way, feeling of sickness is some stuck energy moving. And because when you first connected with the small intestine U point, I felt tears fall.
Right, there we go.
So I know that there's quite a strong emotional component in what feels like quite a physical thing. If I tune in. And so I'm not surprised that some energy moving is going to make me feel a bit sick, but it's something I'm familiar with from Shiatsu as well. That passing, absolutely. Just a little feeling a bit sick, or how you sometimes I get it when I'm meditating. Sometimes just get a bit of a headache for a moment.
Of course,
it's like something having a move.
Movement of energy sometimes is can be uncomfortable.
Exactly.
Okay, great. Let's go back. I think let's see. We've only got like 10 minutes left. We've done a lot of the questions though. So, would you like to? Can I lie down?
Of course you can.
Because I tend to be a metal element person, so maybe I'll be a good model for the lung. You can just demonstrate the lung, large intestine meridian the back, drinking the back.
Okay.
We've just got 10 minutes left. So.
How is your back, Cliff?
Well, actually, my lower back's okay. I have sometimes had a problem with it. Years ago, I got cold in it, but basically it's okay. But you might want to just check it out and see what it is. Yes.
We'll be checking. So we're just going to look at so I'm just going to check how the key is moving through his lower back. I'm just going to check we're sticking with our kidney and bladder and large intestine, and I'm going to look how key is moving through that lower back area. And you can really see that stuckness around T1 that you mentioned last week.
Yeah.
If you were here.
That's mainly where I get it. Well, I'm going to have to wait till week 3 before I can get that one.
I just want to see how it is. It's a slightly weak feeling, and now actually this is your circles diagram, Cliff.
Yeah.
Because actually what I'm doing here is just listening out more widely
For the whole
for the
feeling.
whole feeling
Right, yeah.
and the lower back. And there's quite a lot of holding in the upper and middle, and a slight feeling of, I think you're probably a bit tired, Cliff.
Who knows? Yeah, I think it was staying up, doing my lovely chart.
Yeah, exactly. Yeah, great. So I'm now going to just check into those
Viewpoints.
viewpoints. So quite a busy, tight feeling.
Yeah, it does feel tight actually.
And,
So yeah, I was just surprised. I'm surprised how tender it was actually.
Yeah.
Yeah. Maybe I've been doing a bit too much.
I think we might have.
I was just surprised. It doesn't feel so bad though.
No.
Oh, I don't know. Yeah, oh, that's it. That's a small intestine, isn't it?
No,
Oh, that's.
large intestine.
Oh, right. Okay.
And that feels more.
That's large intestine, is it?
It feels more stringy, weak. It feels weak.
Okay. Yeah. I noticed last week that some people didn't know the extended meridians in the leg.
Kim, it was, yeah.
Yeah. So actually, large intestine is a good example of how essential it is really to know those.
And bladder's got the same sort of feeling as kidney. It's got this slightly.
It's quite sensitive actually.
Yeah, it's quite sore, isn't it?
Yeah. Surprise.
But and so I would say if I had to, in fact, I'll check the horror
Good idea.
because basically it feels like kidney, bladder more jitsu,
Yeah.
and large intestine more kyo.
If you had to guess from the viewpoints.
Exactly.
Okay, that'd be interesting to see
Yeah.
how whether it correlates.
We're only just checking our
Lower burn only this week.
lower burn only. In fact, they feel more kyo than I expected. No, that's where I'm going with.
Kidney, bladder, jits, and large intestine care.
Yeah.
That makes sense. That's great. You can demonstrate large intestine care then. And see. And, see what happens.
Okay, so actually what I'd like you to do is lie on your side. Is that
Okay,
okay?
yeah, sure, yeah. Maybe this side.
Just because it's easier for me. Yeah, and I have to look after my back. So, do you mind putting this leg over? Or you might have to move around with your camera. So, I don't know if you can see people, but imagine putting your hands here on this kidney area, and then a bit lower on this large intestine areas, right down at the base of the lumbar spine. It's just got this slightly frail, weak feeling to it. So the easy way to work the large intestine in the leg is in this position. So I'm really listening here, but I've also got some contact with the jitsu kidney feeling up above. So I'm just listening out to see what I'm looking for the connection between the kyo large intestine. I'm getting a nice change in there.
Can we just describe where the large intestine channel is, just in case people don't know where it is?
Okay, so here's gallbladder down the midline, all the way down, and large intestine just behind it. So it's on, if you divide the leg into side and back, it's on the posterior aspect of the side. So it's just gallbladder, large intestine. So really easy. You can contact the large intestine diagnostic areas. I'm interested in the back, so I'm coming down here, but I often use it for treating bowel conditions, and tune into the physical bowel under here, or the back diagnostic area, or the hara diagnostic area. But here I'm interested, and you can come across, depends on how they lie and how you are structured compared to them. But there's a quite, here it's beginning to open better now, whereas when I first went to it, it felt a bit weak, but also a bit closed off. Now it's beginning to open and connect out more onto higher vibrational levels. So that's a background story, because I'm really interested in the back. That's our aim today.
That was good, that last one.
Yeah.
That's a really good one.
Yeah, for the back.
Yeah. Feels pretty.
Nice. Huh?
Yeah, very good.
And it goes straight down all the way, lovely Masanaga Meridian, like a motorway, and then on the edge of the foot to the base of the toes. And of course I can do the kidney and just see, ooh, it's that, just check bladder and the kidney. And here I'm using my knee to give me the power.
I could lie here all day, but I'm sure we must be running out of time.
That's what I was just
Just
watching.
2 minutes ago. Thank you, Dan. Oh, I think I might have to get you to do the other side after the webinar ends.
Yeah.
Right, okay, let's have a look. Just quickly go back to the chat. Oh yeah, sorry. Yeah. Let's change the camera back to the other camera. Okay, there we go. Hopefully the 2-camera thing helped you follow what was happening. Shakura's doing a great job. Let's getting all the angles in for you. Okay, so here we are. Let's just have a quick look at the rest of the slides. I think we're nearly done now. So that's my new chart. You can see what we were doing. We were basically getting a combination of local palpation, body tissue diagnosis using viewpoints and the channels, and then meridian resonances. Both Diana and I demonstrated that, actually, how you get resonant information from the hara. And later on in the course, we'll look at multidimensional stuff and see how we're getting on.
Which I'm sure, as we remember when you were working on me and I said, oh, that felt more ancestral.
Oh, yes, yeah.
And also when I was working on you just then, I was getting information that wasn't to do with your lower back at all. And I'm thinking, we're all doing that all the time.
Multidimensional, yeah. Okay, so we've looked at Western medicine and back pain. That was a good review, wasn't it? We've looked at the advanced diagnosis, practical treatment methods, and we've looked at lower burner. You've got the handout, so you can check out any points. We've mentioned most of the really important ones anyway. We've done the Q&A. So next week, we're going to look at TCM and back pain, middle burner back problems, diaphragm, and the lower thoracic, really important, and look at tensegrity.
Oh yeah, great.
So, great.
Camera
Well done. Fantastic. Okay, thank you, Rachel, for that feedback. So the way we set up the webinars is that you have to register for each one separate. It's not a series. We just sort of experiment with that. Like some feedback on that. So you just need to, I'll send you an email again if you haven't already registered for next week, or you can use the same link. You can go on newngwork.com and just follow the link and choose the next session. See you next week. Thank you, Shakura, for the camera work. Thank you, Dinah, for the lovely work. And lovely to see you all on the chat. I'm going to put a heart on the chat from all of us. And then it's goodbye and see you next week. Okay, bye.
And